Hi, I'm Dr. Beyer. Welcome to my page on carpal tunnel syndrome. Carpal tunnel syndrome, unfortunately, is one of those conditions that can really be disabling. Whether or not you use your hands a lot for work, it's even worse if people are suffering with it who use their hands a lot. But irregardless, it can become very disabling for people, cause a lot of pain and numbness and burning of the hands and even up into the forearms. And most of the time, we're able to successfully treat carpal tunnel syndrome, quite honestly. We have some very effective treatments which can decrease the inflammation and swelling on the nerves in the wrist area, which is what's happening with carpal tunnel syndrome. The nerve that passes through the wrist and into the hand is being pressured as it passes through a tunnel-like structure. And most of the time that pressure can be relieved non-surgically. We utilize some different therapies in our office to accomplish that, and including low-level laser therapy, or what's sometimes called cold laser therapy, because it's a non-heat producing laser treatment as opposed to the laser that's used for eye surgery. We also check to see if there's any impingement in other areas. That's one of the reasons why, unfortunately, a lot of people, they have surgery for carpal tunnel syndrome and they're just as worse off, or the results don't last too long. And that's because sometimes they have impingements of the nerves in other areas, such as the elbow or shoulder and neck area. So we always do a good thorough exam and check those areas in addition to evaluating the wrist to see where exactly the pressure is. And for those other areas, we are able to, again, most of the time, relieve the pressure. We do, for the neck, for example, we do non-surgical spinal decompression. One of the few offices in the chiropractic offices in the area who utilizes that treatment, and that can increase the spacing between the vertebrae, taking the pressure off the nerves. So we have really good results the majority of times. It's not something that you need to or should rush into surgically to treat it, because that has, quite honestly, a poor statistical success rate, and we have a very high success rate with our natural approach. So I encourage you to fill out the box on this page and request a report from our office, no charge, on how we treat that, or just to give a call and set up an appointment to see if you're a good candidate for our therapies. Thank you.